My name's Scott Graham. I'm an orthopedic surgeon. I'm chief of ortho down at Saddleback Hospital. I've been in practice about 8 years down in the area, and I take care of a lot of patients, do a lot of surgery. And one of the things that's common in my world is I have a lot of patients with pain, a lot of patients with inflammation. And traditionally we treat inflammation with a lot of drugs, and some of those drugs, you know, ibuprofen, Advil, Aleve. Some of the newer generations, one like Celebrex, Bextra, Mobic, Vioxx, it's no longer available. And the reason why we use these medicines is because they're great anti-inflammatories. Medications are great when they're used appropriately in short term, but when they're used long term, they can cause a lot of side effects. And we see those side effects as physicians. Not everyone has them, but the side effects can be very bad. Bleeding ulcers, kidney disease, people get hooked on medications. And so one of the things that I've been doing in my practice for the past few years is just talking with people and saying, you know, there are other alternatives. There are natural anti-inflammatories. There are other pain medications that you can try rather than the traditional naproxen, ibuprofen thing that we dish out a lot. So what I want to do today is just kind of give a brief talk about omega-3's antioxidants, what they do, why we need them, and how those in Moxxor are so different than what you might go buy on the shelf. Briefly, and real quick, if you have any questions, please feel free to ask. Okay, I want to make it an open. Don't hold on to the question, and there is no silly question. Every part of our body starts with a cell, and cells are really what make every organ system different. Cells are maintained by special phospholipids that are in the cell wall, the cell membrane. And what those phospholipids do is they help stabilize the cell. Omega-3s are one of the key things to cell stability. When you have a cell that is unhappy, what it does is it starts secreting factors like interleukins or cytokines or tissue necrosis factor. And what these substances do is they start the inflammatory cascade. And the inflammatory cascade is what you know as inflammation, what creates redness, swelling, and pain. So the end result of that is, as we know, pain. When we take medications to counteract the pain, we're actually stopping this process. So this just easy thing. Ibuprofen comes in, it stops the cascade from occurring, and we have less pain. We don't feel that. Okay? And that's a great indication and a great use for it. The problem is that when you take it again and again and again, keep taking it, it starts causing other problems. There's other systems that it inhibits also. One is the GI system. And the GI system means your stomach, the lining, your intestines. And when you take anti-inflammatories, it inhibits the ability of the body to protect itself. And what happens is that people get ulcers. So when you start blocking good things, you get complications. So the GI system is one of them. Additionally, the kidneys, if you look at the renal system, if you take a lot of anti-inflammatories, you start having, you again start blocking a normal process, and you start getting kidney problems. So what the pharmaceutical companies did is say, well, let's try to let's maximize this, and let's decrease these side effects. That's where these COX-2 inhibitors came out, like Celebrex and Vioxx. The problem with that is that it created another problem, and this is your heart. And when it started blocking normal functions in the heart, people started having higher incidence of cardiovascular events. And that's when Vioxx got pulled. So the difference between really allopathic medicine, or what we are taught, and alternative medicine or homeopathic medicine is really the difference between treating this side and treating that side. When you look at taking high-dose omega-3s, what they do is they help stabilize the cell. They decrease this from occurring in the first place. So it's really working at the cellular level, not once it's already occurred. And that's really why this is prevention, and this is more of a knee-jerk reaction. And this is really what we're taught. And all this is very important, but you got to understand the basis of what these things do. So most people take omega-3s for their cardiovascular system. Their doc said, hey, you take omega-3s, it's great for your heart. Okay? And this is probably the easiest example of how omegas actually work functionally. If you take your blood vessel, and let's just say there's the lining of the blood vessel, and this is basically the lumen. We know that in our blood we have cholesterol. Okay, cholesterol goes through, and it's just a part of our normal blood. And cholesterol actually isn't a bad thing. It gets a little bit of a bad rap. We need cholesterol in our body. We need more of the HDL, which is the good cholesterol, than the LDL, which is bad cholesterol. But cholesterol does serve a function. And one of the functions it serves that just makes this really easy is that a lot of our blood vessels in our body are inflamed. And the reason they're inflamed is for many stressful reasons and our environment and our diet or whatnot. And we know very well that inflammation in a vessel causes a little bit of damage. And when you have an area of damage of a blood vessel